Welcome everyone to Unpacking New Guidelines for Health Information Credibility on Social Media, a webinar brought to you by the Center for Health Communication, the Dr. O'Donovan Medical Education Platforms, and the Stanford Health Equity Media Fellowship. I'm really thrilled today to be facilitating the conversation with Dr. James O'Donovan and YouTube's Ifelola Ojuri. We're going to spend the next hour or so talking about the guidelines that were recently released by the Academy of Medical Royal Colleges on how we can all assure the credibility of health information sources on social media platforms, which James, as a physician and a successful creator, helped the Academy to define. Those guidelines build off ones developed for the U.S. context by the National Academy of Medicine and complement work done by the World Health Organization. It's really good to see so many organizations putting time and attention into how we might improve the quality of health information that's available on these platforms, because it's a really increasingly important way that people, especially young people, get information, including their information about health. But before we dive into those guidelines and what they might mean for the healthy information ecosystem at large, let's get to know our expert guests. First, Dr. James O'Donovan, him, is an NHS physician in the UK and a creator of the popular Dr. O'Donovan medical education channels. He's also director of research at the Community Health Impact Coalition and a technical advisor to the World Health Organization. And next is Ifelola Ojuri, she, her, is a strategic partner manager with YouTube Health. She has a background in public health, social media strategy, and content creation. Welcome to you both. I'm really happy to have you here. Okay, so James, I want to start with you. You work, as I said, both as a physician and as a health content creator on social media. Based on what you're hearing from your patients and what you're seeing online, can you explain why you think these guidelines are necessary?
Yes, well, first of all, thanks so much, Amanda, for having me here today. It's a real honor to be on the panel with yourself and also for Lola. And I think it's a really great question to kick off with. So as both a physician and a health content creator, I do think there's a huge need for these guidelines, but I do want to preface this by saying that I don't think the guideline should be seen as a silver bullet solution to addressing information quality and misinformation, but rather I think we should view them as an essential framework and a guiding structure, and what I believe we could refer to as step one in what I think needs to be a multi-level and multi-pronged approach to this really enormous challenge that we're facing. So I'm going to split your question down into two sections. So the first, to answer the first part of your question from the perspective of my patients, in my opinion, I think the most important function of the guidelines are essentially to avoid patient confusion and misinformation. So to take you back to the very beginning, before these guidelines were conceptualized and come into fruition, patients would regularly come to see me with questions and concerns based on information that they encountered online. So I can give you a really good example of this. One patient of mine came to me totally overwhelmed with advice that they'd seen online regarding healthy weight management. So they were receiving basically contradicting information. And when they reviewed the channel of a really popular health guru with essentially millions of followers, they were really confused as to whether or not they were a licensed clinician or not. So I think the benefit of platforms like YouTube is that when they're used well, they can be a great leveler and they can circumvent what I consider the traditional information guarding that can be present in the biomedical industry. But I think the challenge is now that much of the information is a mix of both accurate advice and then unfortunately harmful misinformation that's not necessarily grounded in evidence-based medicine. And I think trying to navigate this space as a patient is increasingly challenging, both for the patients, but also for health providers such as myself that are trying to signpost my patients to high quality information. So I think this is where the guidelines really come into their own. And they're essentially the first step of helping to ensure that patients are receiving reliable information, reducing confusion, and also the spread of misinformation. And we can discuss some of the practical examples in more detail later. But I think things such as clearly citing which evidence you're using is a really helpful practical example of how this can be enacted. And similarly, the guidelines state that you should articulate and disclose whether or not you've got financial conflicts of interest. And I think this is really important in what is becoming a very commercially valuable space, but one which could lead to unethical practices. So I think that's the first step in terms of where these guidelines are really helpful for patients. And then just moving on to the second part of your question, I would say if we step back and we zoom out to look at a more macro perspective, which is what do the guidelines mean to the health space more generally? I think there are three key areas. Firstly, overwhelming volume of information is now present online. And I think that the guidelines are essentially providing a framework both to help content creators produce more accurate health information that's grounded in best practices, but also having a really clear and documented process for making this content and making sure it's accessible and transparent. I think secondly, they're really helpful in enhancing public trust. So people are increasingly turning to social media for health advice. And I think the aspiration is that by following the guidelines, we can try and enhance public trust in the health information space online. And then thirdly, I think there's this idea of greater professional responsibility. So as a physician, the underlying principle of the work we're doing is first, do no harm. And I think these guidelines are helping support health professionals maintain both high standards for online content, but also ensure that our contributions are beneficial and not misleading. And we can talk about a practical example later on.
Yeah, fascinating. Okay, Ifelola, I want to turn to you. Can you tell us why, from your perspective, YouTube has a vested interest in this kind of work?
Yeah, of course. And so if you think about it for a minute, we know that Google is the largest search engine in the world. And then actually what comes second is YouTube. So people are coming to YouTube looking for their health information. We know that in the US, almost like 6 in 10 adults search the internet for health information to inform their health decisions. So really it's like this like right playing field, right? Of people are looking for it, they're searching for it. How do we meet them where they are? At YouTube Health, we really think about democratizing like access and access to information. So these guidelines, they really fit in with our 4Rs framework of responsibility, of reward, raise, reduce, and remove. And it helps us to know like what to surface in terms of what makes something authoritative, what makes something like quality. And it shouldn't be like the platform saying that, it should be coming from like the experts such as like Dr. O'Donovan that we see here today and other people kind of letting us know like this is what the type of information people are looking for, and then we as a platform are able to surface it and show it, and these things go hand in hand.
Yeah, that makes a ton of sense. All right, so one of the biggest recommendations here in these guidelines is that platforms should focus on assuring the credibility of the sources that are sharing health content rather than looking at the credibility of individual pieces of content. I'd love to hear what you see the advantages and the disadvantages of focusing on sources versus content. And I'd like to hear both of your perspectives, but maybe Ifelola, we can start with you.
For sure. As I was thinking through this question, I guess some of the disadvantages is that you miss the granularity of going by content approach of, okay, am I looking specifically at the video instead of the wider source? But in doing that, you then have to use so many more resources and it's not as scalable. If we think about the impact of YouTube and the ability to reach so many people, you have to build with the end in mind. And so when we were thinking through how do you reach as many people as possible, starting at the source and leveling up allows you to build an infrastructure that is equipped for scale. And it means that within different regions, you're able to scale further and so on and so forth. I think another advantage, kind of flipped to the other side here, is that you are able to see in the same way that as someone who is going through their process of becoming a licensed clinician of whatever type, in the end, they are saying like, I myself am ascribing to all of these different things, which would make me credible, authoritative and whatnot. And we wanted to kind of mirror in the process of if you yourself are saying overall, I'm working towards this and the evidence is changing, the way in which like science moves is pretty quick, but my goal and intent is to do this, like the content should also reflect that too.
So yeah, I think yeah, those are all excellent points that Ifelola's made, and I'd probably echo a couple of those. But I think if we zoom out again and we think about this as building a scalable system and also having foundational building blocks, I think that's where the value of accrediting individual sources rather than individual bits of content is probably a better approach. So I think if we draw parallels with, say, doing research, for example, when you're learning how to do research, you learn about the basic foundational principles of things like ethics, methods, different study designs. The final output is the research study. And whilst we're judged on this in terms of how many times it's been cited, like how many times our videos are viewed and engaged with, it's actually the underlying principles of how to do it well that I would say are most important. So I think when it comes to verifying individual sources, I think there are two main advantages rather than individual bits of content. So I think firstly, efficiency and scalability. So it's much more efficient to verify individual sources rather than each bit of content individually. And given the vast amount of health information that's shared daily, it's impractical to vet every single post. And then secondly, maintaining a good working relationship with creators. So to frame this as a content creator, I make all of this in my spare time, and it's just helpful to still have that sense of autonomy and not know that every single piece of my content is being checked and vetted. I think the downsides of this approach are that relying solely on the credibility of sources that may overlook biases that even the credible sources can have. So it could lead to potentially skewed information that's being disseminated based on the source's perspective or interests. And then I would say that finally, even the credible sources can occasionally share inaccurate or outdated information. So this might allow erroneous information to slip through and ultimately potentially harm patients, but there are hopefully steps that are put in place to try and avoid that.
Yeah, possibly layered solutions, right?
Exactly.
Very interesting. Okay, so because of feasibility issues and scale and things that you've already discussed, these guidelines aren't designed to be a system of some kind of mandatory requirements for creators. So, right, it's a different kind of adoption, James. So I'm interested as a creator, why would creators like you use these guidelines? Like what's the driver for someone like you?
Right. So yeah, I think this is an excellent question. And I think the Academy have been quite savvy in not mandating these guidelines. And I think practically, given the diverse field of health communications, it would be quite challenging to enforce these as mandatory. But I think from a professional standpoint, professionals like myself are more likely to use non-mandated guidelines because they allow us greater flexibility. They allow us to essentially adapt things to specific contexts. And I think it helps us maintain the sense of individual creativity. And so I think there are three reasons that I have chosen to use these guidelines, even though they're not mandatory. So firstly, I think they help enhance my credibility and trust. So we know that audiences are increasingly seeking health information online, and people need to trust what I'm saying. And trust takes years to build, but it can take seconds to dissolve. And I think the framework that the guidelines provide is a really helpful tool for me to draw upon and try and enhance that trust and credibility and make sure that what I'm putting out to the public and to my patients online is grounded in this credibility and trust. I think secondly, it helps improve the quality of what I'm making and helps me keep in line with what I consider best practice. And so because medical information is constantly evolving, by following the guidelines, I can essentially ensure that my content is remaining accurate and current, and it's reflecting the latest best practices. And I would say that generally in the field of medicine, we do have best practices for everything. We have best practices for cardiology, respiratory, basically every specialty out there. And I think that content creation in the health space should be seen no differently, given the potential for harm potentially being enormous. So, an individual creator could have millions of subscribers and reach hundreds of millions of people. So I think having these best practice guidelines is really important from an ethical perspective as well. And I think that brings me on to my third point as to why I would use these guidelines, which is professional responsibility. So every year I have to undergo something called an annual appraisal, where my whole scope of practice is assessed by an independent person verifying that. So that covers both my clinical work, but it also covers things such as leadership, management, and teaching. And so because my YouTube channel reaches so many people, that falls under my whole scope of practice. And I think the guidelines have been really, really helpful this year in my annual appraisal, where I was able to say I've produced 200 videos this year. And in order to follow best practice, I actually used this set of guidelines that has been approved by the Academy of Royal Medical Colleges. So I would say those are the three key reasons.
Yeah, interesting. So I want to stick with that just for a second and hear how has being involved in the development of these guidelines or access to these guidelines changed the way you make content, right? You talked a little bit about what the pluses of them are. I'd love to hear how it's actually changed your work as a creator.
Yeah, that's also a great question, Amanda. So I would say that I've always been relatively cautious as a creator, and I've tried to come up with my own set of best practice guidelines even years before these official ones came out. But I was always uncertain as to whether or not I was doing the right thing. And so it's very nice now to have something that I can fall back on and just feel a little bit more assured in what I'm doing, and also know that other people are doing this. So I think the first thing that it's helping me to do is make sure that I really make a conscious effort to cite and reference credible sources. And that's actually the first guiding practical principle in the guidelines. So I place a really strong emphasis now on verifying the credibility of the sources that I'm using before incorporating them into my information that I'm going to put into my content. So for me, this involves checking the qualifications and reputation of the authors, checking the reliability of the publications, and now I try to cross-reference multiple sources, both to ensure accuracy, but also to give my viewers a range of sources that then they can go into and access for more information if they so wish. And I try to include resources now that are both based in the US, the UK, and also in non-English language where possible. And that's based on the feedback that I'm receiving from my analytics in the YouTube studio. The second thing that the guidelines have probably changed in how I practically go about making the videos is that I have a really clearly documented structure now for how I go about making my videos. And that actually falls into point 2 of the guidelines, which is to have this clear documented structure in how you're creating content. So previously, I would probably produce a video on an ad hoc basis and publish it whenever I had time. But now I have a really clear structure as to how I go about researching the video, how I go about vetting the information, and then I have a clear structure as to when I need to update the video. So I would go back and check it every 3 years to make sure it remained accurate. And then the third thing that has probably changed is that I try to simplify the complex information as much as possible. Now, this is point 4 of the practical guidelines. And the reason I do this is that in developing the guidelines, we did some research around the accessibility of health information that's available to the general public. Now, the National Institute of Health Research in the UK found that more than 4 in 10 adults actually struggle to understand health content that is written for the public. And actually, quite shockingly, over 7 million adults in the UK read at or below the level of a 9-year-old. And I realized when I went back through my old videos, most of the content I had in there had lots of jargon, very complex language. And so now I try to practically use the Hemingway app to make sure that I'm using short sentences, clear language, avoiding jargon. I think that's something that I've really consciously given thought to since the guidelines have been developed.
Yeah, you mentioned the Hemingway app. Can you say more about that for folks on the call who might not know what it is?
Yeah, no problem. So again, I'm trying to make things as practical as possible for people. And I think that's the real benefit of these guidelines when you really try practically enact them. So there's loads of great resources out there that I've started to use since helping design the guidelines. But yeah, one of them is the Hemingway app. It's open access, free to use. The website's great. You essentially just put your block of text in there, and I would recommend putting, say, paragraphs, and it will grade it based on readability. So in terms of sentence structure, sentence length, use of jargon, and it gives you an overall score broken down into these different components. So it's a really excellent tool, not just for content creators, but for anyone who's writing public-facing work. I think is really excellent.
Ensure the accessibility of what you're writing to as many people as possible.
Exactly. And I think that's a great lesson for anything that we're doing, be it content creation, writing academic publications, or writing things for social media. I think having accessible content is really important.
Yeah, very interesting. Okay, so I'd like, we've heard a lot of pluses from the eye of the creator and so forth, but I'd love to hear what you see as the potential roadblocks to moving guidelines like these forward into common practice. Ifelola, I want to start with you and then turn to James to hear the perspective of the creator.
Yeah, I think the first things that come to mind as like from the platform perspective is it does require additional resourcing and funding to implement some of these infrastructures. So you are creating either like net new processes or things that would not necessarily have been a part of like what was going on in the back end to begin with. And so it is like doable and possible. It just requires this additional step. And I would argue that the same additional step is required for creators, as Dr. Donovan was kind of speaking. I was thinking through, you are adding in additional parts to the process that maybe wouldn't have existed beforehand. Yes, they are checks and balances and they are good things, but the difference between pressing record on your camera and hitting publish without all of these included is pretty big and significant, but in including different resources that help you to do that. I was also just thinking in terms of like the amount of time that it then takes for you to be able to do something such as this. Of you're creating your content, you're doing all of these different things, but then you have to go back through and make sure that, have I cited my sources? Have I included things that make sure that people understand it? Is it engaging? And the nuances for content creation are already quite high. You need to take something and make it accessible, simple, easy to understand, and you have to fit so much into one video while also making sure that you get across like the that key information too. And so I could see that being another potential roadblock. I think the other thing that kind of came to mind as you were speaking was just like the regional differences. And as a platform, you are thinking about things from a global perspective. And so how do you make sure that you have global reach? And these are all things that are applicable in terms of like these guidelines and so on and so forth, but also have like the regional nuances that make it make sense within each market. So I know that in this case, it was done mostly within the UK, as to take what was happening in the US and make it applicable to this particular market. But to my first point too, that requires additional funding, resources, and so on and so forth.
Yeah, very interesting. James, so yeah, from the position of the creator, what do you think about roadblocks?
Yeah, I think Ifelola's made some excellent points there, and I really like the point that you've raised about this adds an extra layer or level of complexity for the individual creators. So most individual creators are doing this alongside their job as clinicians or healthcare providers. So not only are we researching the scripts, we're writing the scripts, we're then producing the videos, we're editing the videos often, then we're doing a lot of the post-production work. So it does add an extra level of workload and complexity to this. One thing I would say about this is, for other clinicians who might be on the call, or healthcare professionals, or even public experts, I would say don't try to do everything at once. Just try to see this as a stepwise approach where you might address one component and take several months to really establish that within your content production process, and then try take on the next step. I think otherwise it could feel overwhelming. And I certainly found that when I was looking at things in their totality, I tried to break it down into manageable chunks. So I would say that could be seen as a potential barrier. I would say other things, if we zoom out again, and I just would like to add to Ifelola's points around, there could be resistance from social media platforms. Ultimately, without the strong incentives or regulatory pressure, platforms might be reluctant to implement the changes that have been proposed in these guidelines in terms of appropriately vetting or rubber stamping who are the people who've got authoritative content that you should be listening to. And then I think just if we zoom out and look at a bigger picture perspective, there are issues around public skepticism and trust issues. So some users may distrust mainstream health authorities, or those people who are adhering to the guidelines and then subsequently approved as validated authoritative sources of information. And so encouraging these people to engage with credible sources could be really challenging. And I know that Matt Mota, who's one of the centre's collaborators, has written about this in his forthcoming book, which is called Anti-Scientific Americans. And I think there's that complex issue of anti-intellectualism that's fueling this. And if people are then going to adhere to these guidelines and best practice guidelines and potentially subsequently be promoted on some of the platforms as being authoritative voices, I think there could be complex issues that are unforeseen and unintended that come out of it.
Yeah, fascinating. Yeah, I mean, I think that trust issue is a huge one. As you noted, the center is really interested in this issue of decreasing trust in scientists and public health authorities, and folks, meanwhile, turning more and more to content creators with lived experience for their information. Given that, and I'm wondering, how can these and other guidelines that are out there be inclusive of health content creators that make that kind of content from the perspective of their own health journeys? They may be providers, they may not. I'd love to hear from you both about that. Maybe Ifelola, you want to start?
Yeah, of course. I was thinking through this as another roadblock actually as you were speaking.
Yeah.
More because these guidelines typically are from the perspective of like licensure based, and like that's the accreditation and verification that we're using in order to say that somebody is credible, authoritative. But we also know that if you're coming to YouTube, you're probably not just coming to see it from like a hospital or a doctor. You want somebody who's also going through it too. and kind of like that human question of like, how do I live with this? And what's the reality of like my day-to-day life now that I'm moving through the world in this way? And at YouTube, one thing that we do have that kind of complements like the medical information side is the personal stories shelves, which allows it's only available in a couple of different markets for like a couple of different conditions. But when you go and look for, let's say, anxiety or depression on YouTube, you'll first see like a health shelf, which will give you information from trusted sources, such as like a doctor or a hospital. But then you'll also see this thing in tandem called a personal story shelf. So this allows for anybody who's like kind of has this lived experience to show up and to their content to be surfaced and elevated. And so then you could see from different communities like what's happening across the board. I think some of the limitations to it currently are it's only available in certain markets for certain parts of people's journey, and it does need to like kind of expand so it can be more inclusive. And I think the other thing would just be thinking through, is there another mechanism or system or set of principles that would allow this to be more scalable in its approach and kind of similar to how these principles are set forth, that would give platforms the agency to be able to find a different way to bring this to the forefront for people.
Yeah, James, what do you think? I mean, curious to hear from the creator's perspective.
Yeah, I would say, building on what Ifelola said, I think recognizing diverse forms of experience is essential, and incorporating health content creators who are essentially sharing information based on their own health journeys is really important. So to give you an example, when patients come to see me who've been diagnosed with dementia, I can give them factual leaflets, I can give them booklets and credible resources on symptoms, treatment options, etc. But more often than not, one of the main questions they have and that their families have is, what is living with dementia like? And it's really hard to produce a fact sheet on that. So those who've got lived experience, who share their experiences online, this can be a really powerful way on so many levels. And I think this is where it's really important. There's a pressing need for this kind of expertise to be recognized. I think practically, I would suggest there could be a version 2 of the guidelines that specifically incorporates this kind of experience and expertise into the guidance. And I think when going about doing this, I think adopting a participatory approach is going to be really important. And then I think providing training opportunities to patient experts with lived expertise is another important step. So practically, this could be workshops or training events where you train creators on how to use these guidelines and integrate credible sources and evidence-based information into their personal stories, which I think could elevate the impact of this even more. And then finally, I think something that could be really helpful for myself as a clinician creator is that establishing kind of partnerships or collaborations between health professionals and health content creators could be really powerful. So finding a way where I could regularly interact with patient experts, where I could ask questions and receive feedback on my content, then also bring them in to feature on my content, sharing their lived experiences could be really powerful and also a practical way of going about doing this.
Yeah, that's a really interesting idea. And I just want to, note if you have any questions to drop them in the chat, and we'll open it up in a few minutes. But I'd like to stay with that, James, for a minute and ask, have you seen that sort of collaboration done elsewhere?
Yeah, that's an excellent question, Anna. So I've seen it done a couple of times. So for example, on the NHS YouTube page, which is the national health provider in the UK, they often share patient stories. I've also seen it done where other creators will interview people with lived experience. One of my colleagues and good friends, Dr. Asmine, has got a very large social media following and has started to do that in a really tasteful way. And then also, I would like to highlight and point out that there are some really excellent people with lived experience who are sharing their journey. So one example would be Misha, also known as Mr. Crohn's colitis, who shares his experience on various social media platforms of what it's like living with a long-term condition and also what it's like living with a stoma. And you can just go to his page and read the testimonies underneath his videos, and you can really see the impact that he's making to so many people. And I think it's very powerful. So something that I would strongly encourage is a body. I don't know whether it would be someone like YouTube or another social media platform where they could join and bring together both the people with lived experience and also the clinicians, because I think there could be something really mutually beneficial there, and we could both learn a lot from each other.
Yeah, well, I will say in support of that the centers mental health creator program certainly saw that happening in real life when we've brought folks with, like lived experience as well as clinicians together, and increasingly seeing some more crossover, which I think is really positive overall. Yeah, I wondered also another thing that I've seen in working with that group of creators is these concerns about how it might be hard to cite sources in shorter form stuff than longer form stuff. So I would love to hear, James, you talk a little bit about what your considerations are when you're thinking of, say, YouTube Shorts or a TikTok style video versus a traditional YouTube longer form piece, and how are you thinking through those guidelines and those different kinds of content?
Yeah, I think this is a really excellent question again, Amanda. So again, I think the initial set of guidelines that have been produced are exactly that, an initial set. And I think over time, there could be various versions. So versions for short form content, which we know is becoming increasingly popular. And for those who might be on the call who don't know necessarily what short form content is, typically content that is less than 60 seconds long, whereas long form content could be longer description videos that could be 5, 10, 20, even an hour long. Obviously, with those longer form videos, it's much easier to incorporate more nuanced perspectives, discuss the pros and cons of evidence. And that's the form of video that I personally make more of, because I like to go into the detail. And I think given my background in research, I find it sometimes difficult to do that in a 60-second or less video. Although I am cognizant and know that that is where general trends are going, and that's the kind of content that people are consuming more and more. So it has been a challenge, and I can't claim to have all of the answers to it. I would say that in short form content on YouTube, you can still go into the description box and add in your extra resources if necessary. And it's actually been really helpful to be part of the Tackling Health Equity Through Information Quality program that Ifelola was overseeing, to actually draw upon the practices of other people who are actually making short form content much more than myself, and see how they're doing these things. So I think having this community is really important. And I think as the field starts to mature and more clinicians and health providers and people with lived experience start to produce this kind of information, having that community and sharing best practices and best ideas is going to be something that's really important.
Ifelola, is there anything you would add to that as someone who works on a platform that has both of those kinds of content?
I was going to say, to your point beforehand, the collaboration between like a trusted source in terms of like a medical expert and a creator is something we saw a lot of during COVID, actually. And there was a very like acute need. And so we saw those two sides coming together and being able to share audiences, kind of share that, hey, my audience trusts me and I'm saying I trust you. How can we do this together and make sure that everybody has the information that we need? I will say, like, as we've kind of come out of the time of acute crisis, that hasn't necessarily carried over in the same way. And I think there is a time and a place now for it to happen again, whereby often creators have like their own stories and things that they would like to share, or like personal experiences. And so how do you find those who are either going through it themselves or have family members who are also going through it, and allow them to find a more natural fit? We also see it in terms of, there was a Kendall Jenner collaboration with like Vogue, and it was talking through like her anxiety and like mental health journey. And so just a couple more of like these like lighthouse keystone moments of bringing experts in to kind of say, okay, like this is the like medical and clinical side of what you're experiencing. Can you speak to the like human side of that experience? And so having more of this intersectionality within the work itself. To what James was saying prior, of the program that I run, which kind of brings together health creators across the board in various different regions to think through what is the underserved group within your purview that you reach, and how can we make sure that there is diversity among like what you're talking about. And I think the same thing would be said here, of the lived experience that we see can often come from like one particular group or one particular person. How do we make sure that we're diversifying what's happening? And I think this approach of coupling somebody who is within the medical field with a health creator kind of helps to do that too. But I I like have hope for the future, and kind of as what Dr. O'Donovan was saying, is really we have to start from somewhere, and that means sometimes like leaving people out, and that's not the intention. The intention is to grow and build and see the change that comes with that.
Yeah. All right. I also wanted to ask a little bit about what kind of incentives do you think need to be put in place either at the creator level or the platform level to really account for, right, these other pressures for like creators, for example, right? They're running small businesses, sometimes unpaid small businesses or largely unpaid small businesses. What kind of incentives does public health or society need to putting in place in order to recognize this extra investment and value it as we should?
Yeah, I don't mind having a go at answering that question, Amanda. I think it is difficult. It is a lot of extra work, and everyone's motivations are slightly different as to why they're creating content, right? So some people, it might be as a creative outlet. Other people, it might be because they are looking to run a small business, and content creation can enable people to have a micro enterprise. For other people, it might be trying to achieve impact at scale and have positive public health impact. So everyone's motivations are going to be slightly different. And I think trying to understand those and mapping them out can be really important. I think for myself, small things such as having a community to be part of and having YouTube who help foster that was really helpful. So some people who've done an excellent job of this at YouTube are people like Ifelola, people like Dr. Vishal Virani, who's head of YouTube Health in the UK. He's helped to curate a group of like-minded clinician creators and hosted best practice workshops, hosted in-person meetups. So I think that's really helped to foster a sense of community and belonging. And then I think small things such as invites to major public health events so that you can both be at the seat around the table and help cover those is also really motivating and rewarding. So I think it's helped open many doors from a professional perspective. And then I think ultimately it's really challenging because something that I really enjoy about making content is the interaction I have online with the people who are viewing my videos. I know it's not possible, but trying to even have a meetup with some of those people can be really nice because sometimes it's quite difficult. You know that people are watching your videos, you know that the views are increasing, for example, but actually having that human to human contact element is really important, but something that unfortunately most of the time on online communities can be missing. So I think yeah, having that could be really nice and motivating as well.
Yeah. All right, well, thank you so much, Ifelola and James, for being here today. One thing that I'm certainly going to be taking forward from this discussion is thinking about, right, how we can support creators who are doing, this kind of work, right? The kind of work that that James, you are, and so many others like you. I wonder, do you have any other like parting thoughts that you'd like to share before we close out?
I'll let you go first.
Oh, okay.
Mhm.
I think just as like hearing everybody speak, I think it's just a testament to like the work that is being done. And I don't know, for me, it's like a good charge and reminder of like, okay, like this is why we're doing the work, and the ability to see changes within the public health field. And sometimes that just takes time, and being cognizant of where we started from versus like where we're heading to, and having like thought partners in this and making it an iterative process.
Yeah, I think that's a great point. And I think from my perspective, the take home, as I've been reflecting on this conversation, is that the guidelines are great. They're an important first step and they're a framework, but they are just that. They're an important first step. And the guidelines can only be as good as the people who ultimately enact them. And so I think taking the guidelines, trying to not see them necessarily in their totality, and trying to take manageable breakdown steps can be really helpful. I think forming a community is also really important to help motivate you as you're on this journey. And I would say that the centre have been really excellent in supporting this. So I would encourage anyone who hasn't done so already to sign up to the centre's newsletter, which shares best practices, but it also highlights individuals who are doing important work in the health communication space more broadly. And I think that's been really helpful for myself, not necessarily people who are present on social media, but doing work in the research space, the policy space regarding health communications, and we can draw upon important lessons from that. So I would say the newsletter that's put together by the centre is really excellent. And for anyone who is new to the centre's work, I'd encourage you to check that out further on the website. And thanks once again for having both of us on.
Yeah, thank you so much, both of you, for being here again today. If you're interested in staying up to date on future events like these, or as James has mentioned about health communication best practice, make sure that you subscribe to our newsletter using the QR code that's on the screen. Thank you so much to everyone for being here.
Thanks.